So today we have um, a training, a presentation about the CHW benefit and CHW certificate. And this follows up with, this is a follow-up to some of the requests that we have learned through your interviews with Joanne Lee, my colleague on the call here, where there's been a lot of interest to learn about the 101 level of the CHW benefit, what are the requirements to serve as a CHW supervising provider in the Medi-Cal environment, and to learn more about the covered services and how the CHW certificate plays a role in this policy that's um, provided by the Department of Healthcare Services. So I'm going to share my slides here, and this is really meant to be a conversation. And while I'll be presenting, if I can get screen sharing permission, that'd be great. While I'll be presenting the material, I highly welcome Danny and Dr. Malachi to just jump in at any time. And feel free to ask questions and seek clarification. There's going to be a lot of, I think, rich content that we'll cover, and some of it might need some just additional clarification. So I'm going to share my screen here and go into presenter view. Just want to confirm that you both can see this. Okay, fabulous. All right. So I think I've introduced myself and our team before, and so I'm going to skip the slide. We're really just thankful for the partnership with the LGBTQ TA Center to provide community-centered capacity building to potentially help sustain the critical services that the program grantees currently have. And I'm looking forward to working with each of the grantees here. My team and I are really looking forward to working with each of the grantees to explore various pathways to sustain your everyday services that are currently funded by this grant. So this slide shows some of the learning objectives for today. You may have seen this by email from Min or Alex recently. But today we're going to give a high-level overview of the CHW benefit and the CHW certificate requirements. By the end of this learning collaborative session, we hope that you can describe the key components of the benefit, including eligibility, covered services, and the role of the certificate. Hopefully you can walk away with being able to explain the PAVE process, the provider application and validation for enrollment. And just really quickly, I wonder if Malachi and Danny, if you've heard about PAVE, the provider application and validation for enrollment. Have you tried submitting a PAVE application before? Oh, okay. Okay, I see Malachi nodding, and Danny shaking. Malachi, could you help describe if when you may have submitted that PAVE application and what the status is of that?
Yeah, we submitted that 2024, I think probably in like September. But our application was denied. So it was
Okay.
denied at the beginning of last year. We haven't had a chance I mean, this is why we're kind of coming back to some of these processes to ensure that we can, when we re-engage the process, that it'll be successful
Hmm.
on the next round. But it was pretty, in terms of like the seamlessness or the information that they provide, it was pretty helpful. Um, but as with any process, you have to do it exactly how it aligns and matches with the expectations of the broader org. And so there was something that we did that didn't match those expectations.
Got it. Got it. Okay, that's good to know. So it sounds like the application was denied, and your organization hasn't had a chance to resubmit it with the corrections. Okay, and that's completely fine, and we can in a future session go through some of the best practices to submit an application that won't get denied. And this is, and for Danny's awareness, this is the application that every organization needs to submit to the Department of Healthcare Services in order to serve as a Medi-Cal provider before going into contract with a managed care plan. In this learning collaborative session, we'll also get a chance to walk through some of the CHW services billing scenarios. And so you can get a sense to see, get a sense of how the services might translate to a specific revenue to support your CHW or similar workforce and CHW services or services that are equivalent to CHW services. So in this training, I'm going to walk through these components. I'm going to provide first an overview of the benefit, provide a high-level overview of PAVE. We'll go through the billing scenarios. There's a new standing recommendation policy that the Department of Healthcare Services rolled out this year that allows folks to deliver CHW services without authorization of a licensed clinician for a specific number of units. We'll talk about the care plan development. This is when a licensed clinician is required after delivering a certain number of units. And then we'll talk about the certificate. So this is meant to be super high level. And in the months following this session, we'll do a deep dive in each of these areas. So how does that sound for both of you? Okay, great. Awesome. So let's get started. So just starting, going back to the 101 and basics. So the Medi-Cal CHW benefit, the Department of Healthcare Services, they made this benefit available as of July 1st, 2022. And these services are available to all eligible Medi-Cal members. So the clients and patients in which your organization serve have to be Medi-Cal enrolled. And this is what we see this service being made available in both fee for service and managed care delivery systems. So the benefits, the services are covered as they're described as a preventive service benefit. And this is a benefit that the state of California partners with the federal government. The federal government has allowed non-clinical CHOP services to be eligible for reimbursement. And so the services typically, in these cases, need to be recommended by a physician or another licensed practitioner. But we should note that a standing recommendation policy was implemented to reduce this particular barrier. And when we talk about CHWs have over 200 titles across the state of California. There are navigators, promotoras, there are representatives, there are health educators. I'm curious if, Danny and Malachi, if you can share one title that might be similar to CHW from your organization.
Community support services specialist and community care manager.
Mhm.
Community care manager, community support services specialists. Yep, those are really
Mhm.
great titles.
We have an aging and disability navigator specialist, something like
Aging
that.
Aging and disability navigator specialists. Yes, absolutely. So these are all, I think, professionals or professions that can be categorized as CHWs. CHWs who are trusted members of their communities. They have lived experiences, both personally and or professionally. And these are the folks who can bridge that gap, right? And increase access to critical health and social care services. And so these are, I think, this is just an overview of that. This slide, we crafted this slide in partnership with the Department of Healthcare Services to really just visually show what it takes to for the CHWPR services to how it gets delivered. So the Department of Healthcare Services, and I'll just do some annotations here. Let me see if I can. Yep, I don't see an annotation bar. Okay, no worries. The Department of Healthcare Services, they partner, they contract with 24 managed care plans in California. And I wonder if Danny and Malachi, if you can drop in a chat box for your organization, if you know of your local managed care kind of plans or health plans in which your clients and patients serve. This is really great information for Rodora, Joanne, and myself. We were friends with a lot of these managed care plans. Make very intentional, close connections with each managed care plan because each managed care plan has their own version of getting kind of providers ready for the CHW benefit and other Medi-Cal services. Oh, no worries, Danny. No worries, Malachi. How about this? Why don't you drop in the counties in which your organization serve? That'd be really, really helpful. Usually managed care plans are organized by counties. Okay. So Danny, San Francisco County, um, any additional counties beyond San Francisco by any chance, um, in which your members may come from? Because San Francisco County, we definitely see, yeah, some Alameda, maybe Contra Costa, San Mateo. So, it's good to be prepared, right? Because I think sometimes we may or may not know that Medi-Cal members, that the clients and patients who we serve could be Medi-Cal members of a health plan in Alameda County or a health plan in San Francisco. And Malachi, thank you for sharing Sacramento, El Dorado, Yolo. Okay, so you covered pretty much like the northern northern region. That's great. And so for enrollment requirements as a Medi-Cal provider, as Malachi shared earlier, uh, providers must enroll by submitting an application to the Department of Healthcare, to the Department of a Provider Enrollment Division within the Department of Healthcare Services using this PAVE online enrollment system. And we'll do a deeper dive about PAVE later. I just have one slide to show about some of the required documents that you will need to prepare to submit a successful application. So once you submit PAVE and you successfully enroll through the Medi-Cal fee-for-service enrollment process, which allows you to be eligible to contract with managed care plans, then you contract with, as a community-based organization, you contract with a managed care plan to become a supervising provider. And as a supervising provider, you can then deliver what we call covered CHW services for Medi-Cal members. And we'll cover more information. We'll detail more information about these four service areas in the next couple of slides. So as a high level overview of PAVE, as I mentioned, in order to serve as a fee-for-service Medi-Cal provider, you must complete and submit your application using PAVE, which is a portal for the Provider Enrollment Division in the Department of Healthcare Services. We do have these access to these one-on-one training slides that the department has created. We are excited to provide live training around PAVE because I mean the joys of looking at recordings and reading their slides are a little limited at times, but we can do some live training. But what we can do now is looking at this orange box in the middle is start collecting these 7 pieces of documents and just making sure they're updated, they're complete, making sure that that these are up to date. So the 7 kind of documents that are required for submission of a complete PAVE application is listed here. And our team at Community Health Strategy, we've been supporting community-based organizations and reviewing PAVE applications and their materials. And we have a direct contact with the Provider Enrollment Division just to double check, before documents are submitted. Hey, are these bylaws, an acceptable set of documents? Who does it have to be signed by? Is this something that can be improved? We find that when PAVE applications are submitted and when they're denied, and I'm so sorry, Malachi, that you went through that kind of denial process. The response that we're learning from the community that I think that the reasons for denials are just limited and or that they're not as detailed or there's an unknown kind of time period after the denials occur. So it's really important to get the PAVE applications right from the beginning, and the provider enrollment division will review the application within 180 days. And if it's denied, if it's incomplete, it'll be returned to you. And we have a policy, DHCS is a policy that the application must be resubmitted within 60 days to continue processing. So let's move on to the billing scenarios here. Before I move on to billing scenarios, any questions about PAVE from Malachi or Danny?
Yeah, there were some things that came up in it that, I mean, it included these required documents, but, and see, I don't know if that's the piece where we were missing, but there was like a lot of other things that were a part of it too. But I think because we were trying to bill not only community health workers, but also professional services that were counseling services done by licensed providers. So there was other elements that were CAQH number, like there was other pieces that went beyond this. And like we had to have our supervisors and we had to have our list of board members. Like there was quite a few elements that went into this. If I'm remembering, I would have to like log back in. So and there was like some other identifiers. I think we got tied up with one of our like medical facility identifiers. So I don't know. It's like the way that PAVE is created is this is a specific way to be able to bill for particular services. But I guess part of my question would be like we're trying to bill for community health worker services, but also for our mental health related services too. And if there are differences in that process, I mean, maybe that's a question or a consideration for this as well.
Absolutely, Malachi. Yeah, there's a lot of information that's certainly required um, in the PAVE application, and I think you've definitely noted some of the yeah, like the board and management information, just full disclosure of all board members, right, and the managing employees, and there's a requirement to describe the services that they're provided and the types of services, and um, there's also some supporting documents. I think I should have listed here actually a national provider identifier, an
Hmm.
NPI,
Right.
and a business license and an org chart. Uh,
Hmm.
and so I think that's yeah, and then an attestation that describes the reporting of all individuals, such as CHWs, delivering services that will be billed to Medi-Cal, uh,
Hmm.
and confirmation that right that the staff do meet the qualifications listed in the state plan, which
Yep.
we'll get to around the certificate
Okay.
example. So yeah, we can definitely do a deep dive around that in terms of what information that you need to gather in addition to these documents, and we can use the learning collaborative session, in between learning collaborative sessions, to do individual reviews of your paid application. So we can, yeah, I'd love to sit down with you and kind of walk through those documents and prepare you for successful submission. And Danny, same for you for as a first time submitter. Great. And Joanne and Ro, feel free to chime in at any time that you'd like to. Otherwise, Joanne is tracking questions and notes in the background, and she's been just such a great partner in preparing for this presentation. I'm the presenter, but Joanne will document and make sure we're tracking all these kind of commitments. And Ro has been our strategist and our really great partner in the CHW benefit since the beginning of time. And so she's also listening and will chime in with any recommendations and best practices. So this slide is a really popular slide. We've created this in department in collaboration with Department of Healthcare Services to really understand, the various services in which CHW supervising providers can deliver. And so this is something that we'll cover more in detail in future modules, and we can do some financial planning and modeling for your organization on how your services can be tied to the four covered services and how much revenue can be generated. And so we can do some scenario planning. So scenario one here is a CHW, or say it's one of your specialists, right? Who provides health education. Say, for example, it's education on how to have a healthier lifestyle, whether it's having access to more nutritious meals, or to access more physical exercise, or someone to help manage a chronic condition like diabetes or hypertension. So the CHW, they can, provide that service, for example, for 2 hours. That would be equivalent to 4 units. So each unit is equivalent to 30 minutes of service. That's how the Department of Healthcare Services and managed care plans measure the frequency and intensity of the services. And so for one patient for 2 hours, and for every 30 minutes, the base rate is $26.66. And so if we were to do the math, for $26.66 times 4 units or 2 hours, the provider as an organization is reimbursed $106 for that particular service. And this is, there's a billing code you'll see here, 98960. There are 3 billing codes. So this particular billing code is for a CHW service in which you deliver a service for one individual. Now, when you deliver a service for a group that consists of 2 to 4 patients, that billing code is, oops, apologies, 98961. And so say, for example, a CHW provides group health education for 3 patients in a group setting for 2 hours. That's 4 units. This billable rate is $12.66 per unit. And so with $12.66 times 4, that's about $50. And so the total reimbursement for 3 patients in that group setting will come out to $151 and some change. And similarly, there's a separate billing code for a group of 5 to 8 patients. That billing code is 98962. And the per unit reimbursement rate for that is, the base is $9.46. So for, say you conduct a group health education class for 8 patients in a group setting, for an hour and a half or 3 units, this reimbursement for 8 patients in that group comes out to $227 and some change there. So this is this is relative to these 3 billing codes, prior, so the maximum billable kind of unit is 4 units per day per member. So for members, so for say for each CHW, for each member, you're allowed to, per the benefit policy, you're allowed to deliver services up to 2 hours, a maximum of 2 hours for each person per day. Now, if you need to deliver services that exceed 2 hours or 4 units per day, then that prior authorization is required through the managed care plan. And the standing recommendation, which I'll describe later on, the standing recommendation allows your CHW workforce to deliver these services without any plan of care that's written and authorized by a licensed practitioner. You can do this for up to 12 units of care, or 6 hours of care per member in a single year. So for example, if Danny is a CHW and I'm a client and I say I just have a lot of needs right off the bat and I just need to be served a maximum of 2 hours per day, Danny can provide services for me as a client for 2 hours per day for up to 3 days, because that would reach the 12 units of care for that single year. And if Danny needs to continue seeing me for, say, 30 more days after that, you would need to seek prior authorization, and also seek a written plan of care in partnership with a licensed clinician. So I'll pause there. Was this helpful just to walk through some of the billing scenarios and translating the units to minutes, and what thoughts or questions come to mind for you?
I think similarly for doing this with mental health counseling services, what comes up for me is the electronic medical record, or like the ways in which you would have processes in place to make sure that the numbers are being adequately captured. And so it has me thinking about infrastructure related um, processes and practices for our community health workers in preparation for billing. So that's what it has me thinking about. It's like that step around what is the infrastructure that goes with ensuring that this is done accurately,
Mhm.
and yeah, some of the other checks and balances that would go with this process.
Yeah, yeah. Malika, you asked such an important question. Infrastructure, especially around having a data system that can document accurately the number of minutes and units, and that has a coding ability, right? And that the code mapping and reporting ability. That has been the largest, I think, operational challenge for a lot of providers. But we have learned, and managed care plans are learning, that there needs to be just some flexibility around there. So some organizations, they pursue platforms. Well, okay, I'm gonna go from like the super simple solution to the more advanced solution.
Mhm.
A simple solution is start with an Excel spreadsheet. The super simple solution is to start with an Excel spreadsheet. Uh, I would recommend piloting, right? Just like with like one person, right? With a panel of like four patients or clients, and see, how that documentation, that coding, that reporting could look like for that one person. Is that person responsible for documenting, right? Is there a supervisor that's just responsible for documenting? So we have a managed care plan that serves as Santa Clara County. They actually allow the submission of such Excel spreadsheets, and that counts as like as a report. And that it's a small nonprofit organization. They have one CHW, like one billing person, one executive director. It's like a super, super very small nonprofit. And Ro can fact check me here, but they've been successful, I think, in just, submitting their super fancy Excel spreadsheet. And we can ask for their permission to see if that Excel spreadsheet template can be shared. The more advanced solution is adopting a platform. It could be an electronic health record platform, an EHR. It could be a population health management platform, a PHM platform. It could be a case management documentation system. We have heard of various platforms that have been partnering with managed care plans. Things like Office Ally has been a most commonly used platform. Um, there's been an emerging kind of platform called Pear Suite, that they contract with one health plan to do all the kind of claims and billing stuff. The thing with these platforms, what's really important to consider is uh, I would recommend creating an RFP for your organization for the platforms to come forward and sharing kind of their functionalities and their costs, their per user kind of like platform user costs, and ensuring that they are going to meet not just the needs for CHW billing, but for all kind of billing and potential documentation services, right? That the documentation requirements that you may need for other areas of the program. So we often hear and find that folks kind of like get fascinated by one platform, like, oh, this platform seems to do it all. We're gonna like sign up and jump into it. I've heard one organization, they said that they had to spend like $250,000 to set up the platform, and that's just too much money, in my opinion. No way. Like who has a 250,000? And that's when you automatically can say in your budgets, oh, this is not a sustainable program, right? So really, I think starting with that Excel spreadsheet and really also just identifying and learning the landscape. There's so many technology vendors out there that are hungry for customers. They'll do anything to earn your business. They'll put out fancy marketing flyers. They'll buy you dinners. They'll they'll send you videos of like, ooh, look at this. Look at the information and workflow. But we all know, right? We all know after years and years and years of doing various kind of technology platforms, it's only good as, based on how well you use it. And there's always those hidden costs, licensing fees, per user fees, and so that has to be accounted for. So yeah, and also ensuring that the platforms are HIPAA compliant, um, because we are dealing with Medi-Cal member identifiable information, PHI, and so ensuring that that system has the ability to protect that information, and part of this also when you speak with your managed care plan, really learning from them, like what systems do your providers use and what systems have been most effective? What platforms have been the best, for them? What systems do you prefer? Each managed care plan has like a different recommendation or preference. And every managed care plan has their own dedicated portal for submitting reports, and so that's an administrative kind of effort, like time and costs that one must consider when partnering with a managed care plan. So Malachi, I hope I answered your question, but I think hearing your question it brings up a lot of considerations, and so hopefully that addresses some of the questions you had asked earlier.
Yeah, thank you. That's great.
Yeah. And Alex, you asked a really great question. There are a max number of units per person on an annual basis, or on a daily basis, actually. So the CHW benefit permits a maximum of 4 units per day. Um, and there's no cap beyond that, but the standard annual limit with a standing recommendation, so any CHW can deliver up to 12 units per year. That's equivalent to 6 hours per member per year without a care plan, without authorization or a requirement by a licensed physician or practitioner.
Okay, so it's a licensed like medical provider. That was my next question was about if it could be if it's a mental health provider that can sign up on a care plan. But
Yes. Yeah. So a licensed, and yeah, your other question, like, yeah, it could be a physician or other licensed practitioner of the healing arts. And so these include licensed clinical social workers, nurse practitioners. These can include a psychologist. I mean, anyone with a licensed uh, kind of yeah, just anyone who's licensed under the healing arts would count. I'm trying to find the list here. Oh, here we go. I found the list. I'm gonna um
I just added it to the chat, Joe.
oh, awesome. Oh, you're amazing. Oh, that's exactly what I was looking for. So there's so many licensed people here. Marriage and family therapists, um, licensed vocational nurses, pharmacists, and it's not required to have a licensed practitioner in-house in your organization. I mean, if you have a licensed practitioner, great. That's awesome. But if you do not, then this is also an opportunity to partner with a local uh, organization that has licensed staff. And so we've heard some CBOs kind of reach out to their local kind of federally qualified health centers, and because maybe there's a sharing of maybe there are referrals already happening for that Medi-Cal member that utilizes services at your organization and a local federally qualified health center or community clinic, for example. So you can enter in an informal kind of partnership or MOU, understanding that the FQHC or another organization with a licensed practitioner, they can help authorize services based on any kind of good reason that they should. Yeah, go ahead, Alex. It's your hand raised.
Okay, yeah, a follow-up question. So like in the case of an FQHC, like that entity is a Medi-Cal provider, right? And the community health worker is working for like one of our nonprofits. Like could there be authorization for the Medi-Cal recipient who's getting like health classes or navigation services at the community organization? Could like a licensed social worker or psychologist, like you said, sign off on that, but that person doesn't work for a Medi-Cal entity, but it does, even though they're not like employed by, as a Medi-Cal provider or whatever, it still
Hmm.
provides authorization for that patient to get additional Medi-Cal benefits with the community health worker.
Hmm.
That, that's correct.
Okay.
Say like Alex, you are like the CHW working for Open House, for example. Open House is the CHW supervising provider, but say
Hmm.
Open House does not have a licensed clinician, but say Redora is the FQHC, she's a licensed clinical social worker. Redora can, authorize, oh, okay, beyond this 12 units of services that you've already delivered, I can see that this Medi-Cal member needs additional services. So boom, here's my plan of care or care plan that we're going to work together, like, for between, Open House and the FQHC. And that Medi-Cal member can continue receiving services through Open House as Open House as the CHW supervising provider.
Hmm.
Okay, can we do the same scenario except Ro works at Open House as a mental health clinician, and I am a community health worker at Open House, and I'm working with someone who needs like additional support. Can Ro, as a licensed clinician at Open House, authorize like sign a care plan so that my client can receive additional care and there's no FQHC involved in the partnership?
Yes, exactly. So if Ro
Okay.
works as an in-house licensed clinical social worker, whether she's a volunteer or a contracted provider,
Yeah.
employee,
Supervisor, something. Okay.
Great.
they would work with the CHW in partnership with the CHW to develop this care plan and help authorize services beyond the 12 units if you reach that cap in a single year.
Interesting.
Mhm. And Ro, did I get that right?
Yeah, that was perfect.
Yeah, really, really great scenario questions. So, so yeah, whether your organization partners with, oh, and thank you, Ro, for providing the list of providers that's listed in this website. So what the Ro has linked as a very recently updated community health worker preventive services provider manual. This was updated last month, actually, which is great.
Hmm.
Because the state didn't update this in a long time. It's a heavy, pretty text heavy PDF, but it has all I think the language and in regards to the caps and who can provide authorization and who must be uh, who must be involved in the development of the care plan. So
Hmm.
all that is listed there. Oh, nice. And Ro, I see that CHW certificate language has been updated on page 16. Um, yeah. Thank you,
This
Danny.
is really helpful.
Yeah, no, this is great. No, thank you for that feedback. These are really great questions and thoughtful questions. So I'm going to move us forward. And this is something that um, a lot of folks get uh, there's some misunderstanding by some folks that like, oh, like, like as a CHW, I can receive the reimbursement directly. So that's not true. It's usually the provider organization that receives the reimbursement. And there are different types of provider organizations that are eligible. So licensed providers, like private practices, um, small clinics like free and charitable clinics, tribal clinics, pharmacies, hospitals, CBOs, and local health jurisdictions, including county children and families commissions, and or also known as first five kind of agencies. So these are eligible kind of provider organizations. FQHCs are not eligible. Federally qualified health centers are not eligible, but we are. I know there's one FQHC in this cohort, and we are observing some other creative arrangements in terms of how that organization can um, take advantage of this benefit. And as of late October in the state of California, there's almost 300 CBOs
Mm.
enrolled as providers and about 13 local health jurisdictions. So the number of CBOs have been growing, and we're excited, I think, by the continued growth. And a lot of folks get asked, gosh, because of HR1 and the instability of federal funding, will this benefit be around? We just asked this question yesterday with our DHCS colleagues, just very bluntly. It's like, will this be around in the new year and beyond? And they said yes, because this is a statute. This is a state and federal partnership. CMS has approved the ability for the department to deliver such services. So there's dedicated funding. This is just a service that just needs to continue regardless of what's happening in the field. So we're hopeful that this will be just a stable kind of preventive service benefit. Um, so as I mentioned earlier, we just talked about this, right? CHW services, they must be recommended by a physician or other licensed practitioner of the healing arts. The services are listed here again, and the next slide here go into detail around the services for each service. So health education, this is really around focus on promoting a member's health or addressing any barriers they may have to that physical and mental health care. And so if, say, you have staff who are providing information or instructions on specific health topics, this would count as health education. Health navigation, we predict this is going to be a very commonly utilized service because of the Medi-Cal enrollment kind of instability that we're going to be facing in the next several years. So whenever you're providing information about coverage or training someone or referring or supporting or assisting anyone in accessing healthcare, that would count as health navigation. So anything to do with eligibility determination, helping transfer a client from one Medi-Cal managed care plan to another because maybe they've moved from one county to another. This can be, you can get, your organization can get paid for such health navigation services. I know that in my direct service days, we've done a ton of screenings and a lot of assessments, a lot of informal ones and formal ones. So when we're assessing for social needs like, housing, food, transportation, any type of stress you might be experiencing at home because of intimate partner violence, domestic violence, gender-based violence, any kind of screening for depression, screening for utility needs, your organization can get paid for screening and assessment services.
Mm.
And then there's individual support and advocacy whenever a member is experiencing an onset or exacerbation of a health condition or they're about to, experience severe illness, if you're supporting that person or advocating for them, um, and helping them, reach their health goals and offering that peer support, encouragement, or advocacy, you can get paid for that type of work. So I'll pause here to see. I'd love to just pause here and ask. I know Joanne has interviewed all of you to kind of explore this as a potential, like one of many pathways to advance your sustainability efforts. And as we have learned more about your organizations, we've been learning that there are various like mental health services that are offered or even Medi-Cal enrollment. And so I'm just curious to hear from Malachi and Danny. Looking at these buckets, could you share one example that maybe one of your CHW type professions kind of deliver, and how might it fit in any of these categories?
Yeah, I think the services that we provide now fall under for sure the first three. And I'm not exactly clear on like the definition of the individual support and advocacy. We do a lot of like referral out, so I admit that might be like the boundary of what we're doing. But yeah, we're doing a lot falls under these first three categories.
Great, great. That's good to know. How about for you, Malachi?
Yeah, yeah, I think for the GHC, it's all four. Um, and different people are doing different kinds of things, but our community support services team, absolutely with health education, absolutely with health navigation, screening and assessment, and individual support. It's all of them. Um, and they do it in different kinds of, so whether some of that's on the phone, some of it's in person at certain events that we hold. Um, yeah, it fits perfectly. I mean, this is what they do. So yeah, I'm very excited to see about the getting this started with building sustainability here because it's easy to validate um, this work, the work that's being done, because it's already being done. We're just not getting paid for it. So,
Yeah. Yeah, I mean, this is a game changer, I think, for the state of California, where CHW services and similar services, these non-clinical, non-reimbursable, traditionally non-reimbursable services, they've been around for, gosh, for 60, 70, 80 years, right? And so for us to actually finally receive some money, some reimbursement, $26 per half hour, uh, may not be much, in reflection of what many people have been sharing, but it's something. It's something
mhm,
it's better than zero. And it's another kind of source of revenue to help sustain a portion of the FTE or maybe some operating kind of costs to help deliver these services. Um, and in terms of the modality of the services being delivered, Malachi, I think yes, the CHW services can be delivered in person and virtually, including phone or video or telehealth. And I've been getting some other questions like, oh, we do texting, emailing, and chatting.
mhm,
Those are
mm,
typically ineligible, but
okay.
I think that's something I would definitely, for both of you and for others listening to this recording, definitely work with your managed care plan, to be what's allowed, what's not allowed, what are the eligible kind of billable kind of
Mm,
modalities and things like that. So that's something
okay.
we've like to kind of point out too. Um, the standing recommendation policy, so a lot of folks, when they hear standing recommendation, they're like, what's standing recommendation? So this is basically a recognition that while when the benefit first launched, there was, immediately, oh, before you deliver any kind of service, you have to have a written recommendation from a licensed provider due to federal requirements. But as of April of this year, the state has alleviated the barrier through this policy. So the standing recommendation allows eligible Medi-Cal members to receive up to 12 units of services, CHW services every year. That's 6 hours total. And so we reviewed that scenario earlier. Say, for example, if I needed services, I could, Malachi can deliver those services, to me for the maximum of 2 hours per day for 3 days straight, or 3 days of any part of the year. But beyond that, you would need to develop a care plan, and which leads to my next slide. This care plan is, something that can be drafted by the CHW to identify the supports and services to achieve the goals. There's no standard template for this, but we do have some examples from other organizations. And sometimes the licensed provider may not have the time to articulate the treatment plan or the goals for the Medi-Cal member to achieve their health goals. And so the CHW it's recommended for CHWs to be involved. And the licensed provider, whether they're in-house or if you're partnering with another organization, as long as you sign off, then you can resume the issuance of resume the CHW services. There's a lot of confusion about the CHW certificate. And literally up till last month, the state has finally updated their provider manual to reflect this new change. The certificate does not, it's not a requirement. It does not need to be issued by the state. So DHCS, HCI, any state organization, you don't need a CHW certificate. The CHW certificate is one of the pathways in order for a CHW to be able to deliver CHW services. There's a certificate pathway and there's a work experience pathway. The certificate pathway can be, this certificate can be issued by anyone, any organization, as long as the curriculum covers these 11 core competencies that you see on the right-hand side of the screen. So as long as you cover all of these 11 core competencies, whether it's a training organization in California, thank you, Alex. Yeah, no, we'll wrap up really soon. And it could be an international organization, but as long as they cover all these areas, then they would be eligible to deliver services. So you kind of have to show proof. You'll be audited that your CHWs are they have a CHW certificate that's issued by any organization. And after this, every year, CHWs are required to do 6 hours of training, 6 hours of training every year for additional training that's aligned with any of these core competencies. So that leads to the end of the training. I know Malachi and Alex had to jump off, and Danny, you have to jump off soon too. So we have a webinar today, Danny, at 12 o'clock. So in case you want to learn from a provider and a managed care plan on how they work together, we're happy to drop in the link. I'll drop it in here so you can register in case you want to see the recording or you want to send anyone else to attend. So that's the registration link. And thank you so much for your participation. Hopefully this was a helpful session.
Super helpful. Thank you so much.
Thanks, Danny. And thank you,
All
Min,
right.
for all your support. All right. Have a good rest of your day, folks.
Take care.
Okay.
Bye.
Bye.
Bye.